Okay, so for this video, we're going to be talking about oral cares of intubated ventilator patients. So we're going to do oral cares for these patients to help reduce the likelihood that they will get ventilator-acquired pneumonia. So we do these cares every 2 hours to help prevent that from happening to them. So the first thing that we're going to do is we're going to enter the room, we're going to wash our hands, check our patient's vital signs, we're going to make sure that we apply the appropriate PPE, especially gloves, and then what we're going to do is we're going to look at the ET tube for any damage that there may be. Then the first thing that we're going to do after we get our initial assessment of the patient is we're going to go ahead and attach this suction catheter. This will attach to the wall suction at -100 to -120, and then this just sort of has like a sheath cover, so you just go ahead and pull that down, and then you're going to use this inside the patient's mouth around the ET tube to get any secretions that may be sitting in that patient's mouth. So once we've done that first care and we've suctioned them all out, and this just has this on and off type suction, the next thing that we're going to do is hook the toothbrush attachment on to the catheter, the suction handle. So I don't have the toothbrush, but what you do with this is you're going to attach the toothbrush and then you're going to dip it into the mouth, the toothpaste type solution, and you're going to brush the teeth. You're going to brush the back of the teeth, you're going to brush the front parts of the teeth, all surfaces of the teeth in the mouth, and you want to make sure that you're getting those teeth nice and clean. So you want to make sure you're not being too gentle, that the teeth aren't being clean, but you don't want to be too rough that you're causing any pain or discomfort to your patient. So once you brush the teeth, then you can go ahead and turn on that suction and suck out any of those secretions. And so then after you do that care, the next thing that you're going to do is use a little sponge and some mouth moisturizer, and you're going to moisturize all surfaces of the mouth, including the cheeks, the tongue, the gums, the roof of the mouth, and the lips, to make sure that the patient's mouth is nice and moisturized. So then once you get done with that and the next time frame comes around, we're going to go ahead and attach the suction catheter. This is quite a bit longer than the Yankauer type of catheter, and that's what's going to help us get deeper back into that patient's throat, where they're not able to cough up these secretions. This is going to help us to get those secretions out for those patients. So we're going to use this type catheter for that purpose. Then in 2 more hours, it's time to come back and do another oral care for your patient. We're going to attach this kind of bendy looking sponge. As you can see, there's suction in the middle. So to use this, it works very similarly to the toothbrush. You'll dip it into this oral debriding agent, sort of like a mouthwash, and you're going to clean all the internal surfaces of the mouth. Again, not being too gentle, but also not being too rough, to make sure that we are getting that mouth clean, because the whole purpose of this is to try to prevent that ventilator-acquired pneumonia, and we can't do that if we're not getting the mouth clean. So once you get all surfaces of the mouth clean, you can turn on the suction and suck out any of those secretions as well. And then one last time, we're going to do the moisturizer. So we want to make sure we're moisturizing all the internal surfaces of the mouth, cheeks, the tongue, the gums, the roof of the mouth, and of course the lips, to make sure that their mouth stays nice and moisturized. So before you leave the room, you always want to inspect the ET tube, again, for any damage, but also this is a really good opportunity to check the integrity of the skin where that tube has been sitting, to make sure that patient does not have any breakdown. And that is how and why we do oral cares on these ventilated patients.